So I'm going to go ahead and start that up, and I'll chop it off in the end. So we just had a few items to go over, as many of you are already very familiar with. So just be aware that we are broadcasting live and recording. People can hear what you're saying unless you mute. There's a couple of icons here that should help you mute and unmute both your video and your audio. If you do wish to receive a CME or CEU certificate or an attendance certificate, you do need to announce your name during roll call. We do have the chat box feature that I do monitor throughout the session. So feel free at any point to let us know that you're out there. And where you're from too, that always helps further the conversation. Our disclosure and accreditation statements are on screen now. And Molina and Blue Cross Blue Shield New Mexico have partnered with us for our case consultations, and we'll talk a little bit more about that later with Carol. And they will reimburse you for participating in our case consultations here at Envision, and that's through our AHI New Mexico, which is where you are, and as well as every other session that we do. So we can always incorporate a case consultation in. And at this point, why don't we go ahead and start around the room. This is Kevin Whirling, Systems Analyst here at Envision New Mexico.
Hello, I'm Carol Conley. I'm a social worker by training, and I manage the school-based health program quality improvement initiatives and also facilitate AHI for Envision. Welcome.
Hi, I'm Emma. I am an intern here at Envision New Mexico. I'm an MSW student at New Mexico State University, Albuquerque.
I'm Jane Beckley. I'm a nurse practitioner, and I'm working with the Envision Fronteras grant.
My name is Maya Trujillo. I am a quality improvement specialist here at Envision.
My name is Lauren Thorpe. I'm a pediatric resident on my adolescent rotation.
I'm Jen Robinson. I'm a women's health nurse practitioner and a nurse midwife here at UNM.
I am Belina Eam. I'm also a pediatric resident on adolescent rotation.
All right, and a little bit of a change up today. We do have a quick video for you from our Chief of Adolescent Medicine, Dr. Alberta Kong. So this will be about 1.5 minutes, 2 minutes, and then we'll proceed with our topic for today. All right, thanks everybody. It looks like we do have a couple of people who said they didn't have audio for the video, and it is a short enough video we could go ahead and play it again if I can fix that real quick. And my apologies, it looks like we just need to do, make sure that's what it was. All right, we're going to go ahead and play that one more time. Also, if you do have any trouble with the video, we will have it posted on our website, on our videos archive page, as well as on our Moodle page, which you will become pretty familiar with here by the end of AHI New Mexico. So we'll go ahead and play this one more time. It's pretty quick.
Good morning and welcome to the Adolescent Health Initiative at Envision, New Mexico. I am Alberta Kong, the Division Chief of Adolescent Medicine here in the Department of Pediatrics at the University of New Mexico. One of our programs dedicated to quality improvement, Envision New Mexico, has created the Adolescent Health Initiative. It is a telehealth certificate training program created to help you improve the care of adolescents. The Adolescent Health Initiative of New Mexico covers best practice care for adolescents in the following core areas: basic concepts in adolescent health and development, effective communication, laws, policies, and quality standards, and clinical care of adolescents with specific conditions based on the WHO core competencies for adolescent health. The structure will include weekly 1-hour telehealth sessions covering best practice care in core areas. The fall curriculum will focus on medical care, and the spring curriculum will focus on behavioral health. There will also be sessions for case consultation each semester with adolescent specialists. Sessions are open for all professionals, and available is a certificate that you can get for the fall or the spring training or both. We hope that you enjoy our program, and thank you for participating.
All right, great. And thanks to Dr. Kong for recording that with us. And we'll go ahead and go back to our slide set here. So while we're doing that, anybody who is on audio, if you'd like to go ahead and chime in and say your name and where you're from, that'd be great. And then you can get your CME certificate.
I'm Rich Kripke from the University of Rochester in adolescent medicine.
Hi, Rich.
Hi, this is David Godinez from El Paso, Texas. I'm at Project Vida Health Center, part of the Power for Youth program.
Thank you. Welcome.
And I see a number of you have also chatted in, and I'll mark you down as present as well. And at this point, I'll go ahead and turn it over to Carol Conley.
Well, thank you, Kevin, and welcome everyone to Studio Envision. As Dr. Kong said, this is the launch of our Adolescent Health Initiative, New Mexico, and it is our goal to bring you up-to-date information and resources related to the care of teenagers, adolescents. This is a certificate program, and I just want to go over some of those details real quick because some of you might want to do the whole series and get a certificate in adolescent health. Let's see, in order to receive the certificate, you must attend 10 of the weekly sessions, and we're having 12 over 15 weeks this semester. A minimum of 6 of the sessions must be attended live via the web or in person here at Envision. Up to 4 sessions may be completed in Moodle, and there will be a video with a short little quiz afterwards, and we need pre and post participation surveys. We also ask that you present 1 case on an adolescent that you're working with to receive some case consultation from our specialists in-house. And let us know if you're interested. You can reach out to me, Carol Conley, Maya Trujillo, or Michelle Wagner, and it's easy to get a hold of us through our website. And if you're interested, we would love to support you on your journey of improving adolescent health care. Now, I'm pleased to introduce our first speaker. Thank you, Jen Robinson, for opening our series. Jen is a certified nurse practitioner. She's a certified nurse midwife. She's all around an excellent provider of adolescent health care. We look to her a lot here at Envision to inform our programs. She has a particular interest in reproductive health care to adolescents around the long-acting reversible contraceptives, and just generally reaching out to this underserved community and making it a better place for them to come and receive their health care. So thank you, Jen. Without much further ado, you're on.
Hello, everyone.
Today we're going to talk about how to create an adolescent-friendly clinical environment, and I really want to hear what, oh gosh, Kevin, you're really zooming in on me there. Okay. Hello. And I really want to hear from other people, especially from all over the country, about what they're doing, because I will speak specifically to my practice here. So today we're going to talk about how to make your services accessible to youth and how to integrate confidentiality and protection of confidentiality throughout the entire clinic flow for your adolescents, and how to identify the specific needs that young people have and how to connect them to additional resources through your practice. So I will say that I provide adolescent reproductive health care at a pediatrics clinic through the University of New Mexico, and I've worked at several other clinics in the University of New Mexico system, several school-based health centers, and an adolescent reproductive health clinic that is no longer in existence. And I recently started providing care at a community health center in a town just outside of Albuquerque that has a more rural feel. So I can speak to these different experiences in caring for adolescents in different environments. And so I'll give a few clinical examples as we go through that. So having after school, evening, and weekend hours can really increase accessibility.
It's on the computer.
Can we just checking, everybody mute yourself, because we can hear you in here and it's chiming over Jen and it will be recorded that way. So, and Kevin can give you some extra help if you're not sure how to mute yourself.
So it's a great idea to ask youth what they prefer, what hours would be best for them, specific to the youth in your community. One thing that we noticed at some of the school-based health centers in our system is we were so slammed that we were turning kids away that were coming in for same-day pregnancy tests and emergency contraception. So obviously those services are time sensitive, and youth don't always present to us, and when they do present, if they have a sense of urgency, it's a real opportunity to catch them and then build that trust, and then hopefully they'll come back to see you again in the future. So what we did when we noticed that with one of our clinics is we instituted a clinic-wide policy that we would never turn away anyone who's a walk-in for a pregnancy test, emergency contraception, or STI testing. And so that took some work. It took creating a quick visit protocol where we knew we weren't going to get all of our screening done and everything that we wanted to be doing for quality of care done in that same visit, but we were able to meet the needs that the adolescent presented with on that same day. So that took some time and some education and working together as a team. And I will not take credit for that. My colleague Jane Epstein did that at one of our school-based health centers, and then we tried to spread that to all of our different school-based health centers in UNM. So that's just one example of how you can modify your clinic practices to be flexible to see adolescents the same day that they present. I will also say that not every adolescent is always on time. And so having a little bit of flexibility, I mean, not a lot of people aren't on time, so it's not just adolescents, but having a little bit of flexibility, knowing that many adolescents never come to get health care, and if they do end up making it to your clinic, it's a pretty big deal. And so being able to have some flexibility in seeing them, even if they're not coming right at your clinic time, is a way that you can help them get in to see you for care. The other thing that I love about the clinics where I work is there are clinic systems in place to take care of uninsured adolescents and uninsured adults as well. And that is super, super important to build trust in the community and also to provide services that are confidential for people who are uninsured, and then also for adolescents who have commercial insurance, especially in school-based health centers. There is no way for us to suppress what's called the estimation of benefits, which is the list of all the things that were done in the clinic on that day for kids that present that have commercial insurance. So at our school-based health centers through the University of New Mexico, we have an ability to provide services to those kids without billing their commercial insurance. Other important, and we'll talk a lot more about confidentiality in a bit as it relates to that. So I have worked at clinics that are conveniently located and are not conveniently located. So for the clinics that aren't as conveniently located, things that you can do if you can't change your clinic location are offer transportation vouchers for buses or for cabs, offer bike racks, and do a lot of outreach to let people know where you are. Some examples of what I did when we were starting up our adolescent reproductive health clinic is I met with folks at one of the high schools that were in a group called the Women's Senate, met with youth at a bunch of different high schools, and also met with youth at the New Day shelter to find out what their needs were, what barriers were for them accessing care, and what they wanted to see as far as services provided at our clinic. And now we'll be moving to the most important part, in my opinion, of providing care to adolescents, which is confidentiality. And this is really a sneak peek at this very important topic that will be reviewed more in depth by people who do this work all the time at Pegasus Legal Services here in Albuquerque. They're going to come and present as part of AHI on September 20th here. So if you want to learn more about this topic, that would be a great opportunity. So we have people from all over the country, which is really exciting. I have only included here this resource for folks in New Mexico. What I didn't include as far as a link, but Kevin could probably pull it up and provide it to you all. For those who are not in New Mexico, if you want to know what your confidential services are in your state, you can go to the Guttmacher Institute, and they update, I think it's almost every month, a list for every single state of what services related to reproductive health are confidential and what are not. And that includes parental notification laws. And it's not just around abortion. People might recognize that institute is a name that's done a lot of work around abortion. They also do a lot of work in other areas of reproductive health care. So for New Mexico, we are very fortunate in that we can provide the services listed on this document here confidentially to adolescents who are 13 and older. The mental health bit, I'm not going to speak as much to. You can read there about all of the different kind of caveats, but it is important to know that that exists, and the Pegasus folks will talk a lot more about that. Since I'm much more familiar with the top portions of this document, I'm just going to kind of lay out how I talk to adolescents about this. I try to bring this up in every single visit as soon as I can. I say anything we talk about or do related to pregnancy test, birth control, testing for sexually transmitted infections and if you were pregnant, talking about options in your pregnancy are completely confidential. And then I really spell it out. I say what that means is, because kids don't necessarily understand, and we have to be really transparent about the limits of our confidentiality. So I say, that means that no one in our clinic and I will not talk with your parents or guardians about these topics. They cannot access your chart. And I can say that confidently at UNM. I cannot say that super confidently for every single clinic system. And then we talk about the billing issues because I can't promise confidentiality from the estimation of benefit side for commercial insurances. And so I lay that out too. What are the limits of the confidentiality that I can provide? And then I also say, if you're talking about hurting yourself, wanting to hurt yourself, someone else trying to hurt you, then I would have to break confidentiality for your safety. So we do talk about that. I will have this included on the Envision website calendar as one of the resources that's posted. If you do work in New Mexico, what a lot of folks have done is they post this at their clinic, in the front, in the waiting room, so it's visible, and in the exam rooms. You really want to have those visual cues available to back up what you're saying, and so people just have that awareness that this is something that's important to you in your clinic. So we're going to kind of go through the clinic flow and how confidentiality can be woven through the whole clinic experience. So at the pediatrics clinic where I work, what the front desk does when they schedule appointments for adolescents is they get a good contact number that the adolescent wants to use to be directly contacted. And they put that on the subject line of, if they're coming in for dysmenorrhea, they write that, and then they write patient cell is, and they write if it's okay to leave a message or not. So that makes it super, super clear to whoever is doing reminder calls for patients or whoever is going to interact with the patient. It's right there. As far as registration, there are ways to indicate whether it's a confidential visit, and every system is different, but you can also write it in all caps, confidential. That's another visual cue for anyone that interacts with the adolescent coming in for services. Medical records, I have heard a bunch of different very creative strategies as far as how to protect confidentiality related to medical records. I can say that at UNM, the patient's chart is blocked and completely not accessible to parents, I think starting at age 11. Is that what you guys have heard? 11 or 13, I think it's 11. So that means that the parents cannot access the patient's chart without written permission from the patient. So that's one way to protect confidentiality related to medical records. What do you all do in your clinic notes or on your end as providers to indicate when you're writing a note if there's confidential material in there?
I usually say, like, if the mom is aware or not, would say it was something that happened or that the kid did. And then I put it in the note. That way, if they come in with mom next time and I want to talk about it more, I know whether or not I can, if I don't remember, if I can talk about it with mom present or not.
So you just write that kind of like at the top of the note?
Kind of in the middle, or in
the content that's related to that. Or if someone else sees your kid,
right?
Then they know too. Yeah. Anything else that you all do to try to visually cue?
Just leave a little note.
Yeah.
At the bottom of the note.
Yeah. So I try to be really diligent before I'm seeing someone else's patient or someone who's seen someone else to read the whole note. And I'll be honest, sometimes I can't read the whole note. So what I do for myself and what we started doing at School-Based Health last year was writing in all caps, in bold, in red at the top if it was a confidential visit. And that was also a cue for ourselves to suppress the estimation of benefits / eat the cost from our own program. And what we do as providers is just one piece of it. You know, we can write confidential in the notes so we know how to communicate with ourselves or with our colleagues. But what happens behind the scenes about if the visit is confidential or not is a systems-wide thing. And so in school-based health centers, there is a way to make the whole visit confidential, and then it goes through a totally different billing track. But I will be really honest that I do not know how that works at my peds clinic where I work or my community health center where I work. And that's something that we're actively working on at the community health center to try to figure out how can we make this a more adolescent-friendly place. So I'm going through this process myself at my new spot. Allowing adolescents and parents to talk separately in the visit, what I've learned works best for me is at the very beginning, when I walk into a room, if there's a parent there as well, I say, thank you so much for being here. I'm so glad to see that this person has a supportive parent, and I really appreciate you bringing them in. Just so you know, for every patient that comes in here that's 11 or older, we always give them an opportunity to talk one-on-one so they can practice their skills at being in these clinic visits independently. And so I don't even say, like, I'm going to talk about sex with your kid. I just say, like, this is what we do here in this clinic. And I just kind of make it a normalizing thing for every visit so they can have that expectation. And then when I have the adolescent one-on-one, then I can review more details about what's confidential and what's not. And then I save that time to do more of the confidential history, like the social history assessment about substance use or sexual history, contraceptive history, things like that. Having private areas for discussion with other staff or with students or whoever's with you about the case rather than talking in the hall or in like an open space about the adolescent, because if they hear us talking about them, even if it's something that we think is not that big of a deal, they're gonna freak out and not want to come back. So we really want to be able to build that trust and protect that confidentiality in that way too. And making sure that everyone is on the same page about confidentiality, as far as, like, I am very spoiled and lucky at some of my clinics that I have other folks who are able to call my patients back and relay lab results to them. So what I do in every visit is I get a direct cell phone number, even if the front has already gotten it, because we know that phone numbers can change. So I get the best contact number for my patient. I write it down in my clinic note. And then when I am having folks call the patient back to relay the results, I say, please only call at this number. And I write that in. in that, so we can make sure that we're all on the same page. So we've talked a little bit about billing issues, and those can be further discussed in the upcoming confidentiality talk with Pegasus on September 20th. Anything else that you all do in your clinics to protect confidentiality that I didn't mention?
I guess one thing with calling the patient back, I usually ask for a code word because I've heard of stories of like a friend has their cell phone and hears a pregnancy result. So I always ask the kid what their code word is, and then when I call them, I ask for that, so that way I know if I'm talking to the right person.
Yes, that's something that I learned from you all that I have forgotten to do. So I'm really glad that you reminded us. Yes, someone's friend or cousin was posing as the patient, right, when that sensitive result got given, and then it was definitely not confidential. So that is a good creative solution. So one way to identify young people's needs is to institute a screening protocol for all adolescents who come in to the clinic. And Dr. Vaca, who's on today as a participant, will be giving a presentation on social history assessment and the HEADS tool on September 27th as part of our Adolescent Health Initiative series. So she will speak in much more detail than I will today about these specific tools that you can use. So they're detailed social history assessment that I have used in clinic before. I've used the student health questionnaire, which is listed up there in our school-based health centers, and I will say that it unearths way more information than I ever thought was possible to get from adolescents. And so there's no way just from looking at a kid what's going on in their life and asking these really direct questions about what's up with them can help us provide better care to them. And if you come from a family or a community where you don't talk about sex or substance abuse a bunch, which is like most folks haven't really had a lot of experience talking about that on a regular basis, I really encourage practicing with a friend, with a colleague. Practice taking a sexual health history, practice talking about it, and then you might notice how you can help your language and your body language be more neutral, because it takes the shock factor down once you've kind of heard these stories a bunch of times. That's what they encouraged when I was in nursing school, was just practice taking and giving the wildest sexual health histories that you can imagine. So when you hear them in clinic, you're not like, tell me more. So we also all operate with an implicit bias based on our own life experiences. So I wanted to share an example from my clinical practice of how I had my eyes way open by my adolescent patients, and now I'm able to provide better care, that I'm aware of that bias and I've tried to address it. So before I started my job at UNM, I had no idea that adolescents would actually try to conceive, and that would be something that they would want to do. Now, I'm not from here, and I hadn't really specifically worked with adolescents, so I certainly had provided prenatal care to adolescents before. So you would think that maybe I would have worked through this kind of perspective before. But it was just made really clear to me that there are some adolescents that I have been taking care of that actively wanted to try to conceive, and for them, getting pregnant was not an accident, and it wasn't something that was a surprise. It was something they actively wanted. Well, if I didn't know that they were operating from that perspective, and I just went into any contraception visit or women's health visit assuming that they wanted to prevent pregnancy, then I was missing the story, and I wasn't able to provide really good care to them. So I have learned a ton from my teenagers by hearing their stories and hearing where they're coming from and what they're wanting, so I can really individualize my care to them. So that is just one example of many of how we can learn from our kiddos. And this is my last slide. So something that we've done at some of the clinics where I work is change our templates for it, when an adolescent is scheduled, have them have a longer visit. We know that they're not coming in as much as their little kiddos, and they might have more complex needs socially or navigation-wise through the healthcare system. So that's one way that you can help meet their needs. Setting up a good referral system. One example is we noticed there was a huge behavioral health need in our school-based health centers that we weren't able to meet. Even though we had case managers and therapists and psychiatrists, we weren't able to meet the behavioral health needs with just the services that we had. So our amazing case managers got together and they made a behavioral health navigation tool with the local resources that we could use and exactly spelling out for us who to call, how to schedule the appointment for them, how to help the patients learn how to schedule appointments for themselves. And that was a laminated sheet that was in every exam room at every school-based health center in our program. And that helped a lot with those of us who don't have as much experience navigating through those systems as our case managers do. It also took the load off of them and helped us all share responsibility for helping with that navigation. So training staff to help with the navigation, ideally having your medical assistants or whoever else works in your clinics or clinic coordinators be able to do that work can really help. Know your community organizations and what's available to connect your kids. If you have someone who's feeling socially isolated, knowing what's available and accessible to them that can meet their interests is something that can really help. And then one last example before I just go to share my resources and then wrap up. I had a student and I did not have the instruments that I needed to do an IUD insertion for this kiddo. And so I needed to refer them to the health department and the clinic that had those resources. And what I did was I had the patient call the health department clinic while they were sitting in the clinic with me. And they asked some questions of the student who did not know how to answer them. And so we had it on speaker. And so I kind of helped her talk through and do that. So she gained that skill of how to do that for herself. And it did take more time. So I was glad that I had a longer visit scheduled. And then she had the phone number for the clinic to follow up. And I've done that with having patients call the pharmacy to check on a prescription and things like that. Because that's a really important part of adolescent healthcare is we're trying to support them in their health literacy development and how to navigate these systems that, frankly, many adults don't know how to navigate either. So just want to share some resources that, that I've put together for you all. The University of Michigan has an amazing adolescent health initiative themselves, and the link is there. They have a ton of different presentations and tip sheets and resources that are all free. The North American Society for Pediatric and Adolescent Gynecology, I'm very biased, I think they're awesome, and they have provided a really great, Kevin, if you want to just pull this up. So they have a lot of patient handouts. The resource that's most pertinent to what we're talking about today is this tips for protecting youth confidentiality. It's way more comprehensive than anything I was able to review today, but it's a really good resource to kind of run through and see what kind of changes you could make to promote confidentiality protection in your clinic. And then the last resource that I included is a link to the Pegasus website here in New Mexico. It is a New Mexico specific resource called Know Your Rights, and they had a campaign to just let adolescents know what their rights were, which we reviewed with that sheet that was on the slide before. And then, like I said, that other sheet about what confidential services we can provide in New Mexico is included on the Envision calendar. You can print it out and post it in your clinic. That's all I have today.
Thank you so much, Jen. That was really good. There's a couple of things before I open it up to questions that I was thinking about. You said something about every teenager in the risk screen, mentioning the HEDS or the SHQ that we use here in New Mexico. And I think I just want to say out loud how much I appreciate that, the lens through equitable care. Because in work we do in school-based health centers, the stuff I do around early childhood with Dr. Bennett, we're always talking about equitable care and that every kid coming in gets a screen. No matter, you know, it's easy to think they look a certain way or that family's got it all together. I don't need to screen them. But with adolescents, the look and the, you know, it sometimes doesn't match, right? And so that really promoting the idea of equitable care because it's fair and it's just, and you catch those kids and you give them what you need. And I really appreciate you talking about that. So I do have something I guess I wanted to ask your expert opinion or some experience about, because one of the rubs I think when we work with our providers in the clinic around the adolescent visit, and you talked about making more time, a little longer visit, is how do you deal with that? Because there's that push for that 15-minute visit and get them in and out, and you really can't work with, I mean, I've raised 3, my youngest is about to be 16. Things don't go fast, right? So how do you deal with that in your system? And if anybody else has any ideas about that, I'd love to hear, because we're trying to help providers figure that out in their clinics.
I don't know. I think I've just been really spoiled. And so I am working with systems where they acknowledge and appreciate that what comes out of those visits is return visits.
Okay.
And so you're making an investment in building that trust with not just the patient that's in the room, but also their friends and whoever else will come in. And I think it also depends on the mission of the organization, right? Like if our mission is to provide care to the underserved, well, this is a totally underserved community,
Right.
that was an age group. So one way that I've also, when I was negotiating my visit length for the pediatrics clinic where I work now, I do a lot of procedures.
Right.
So I do a lot of implant and IUD insertions and removals, and I manage complex care. And so there was already kind of the understanding from working with other specialists that sometimes specialists require longer visits. And so if you approach it from a specialist angle, like, well, this is specialty care that we can all provide.
Okay.
So I kind of negotiated it with like, well, we're going to throw some procedures in there, which hopefully will increase the revenue too. That's how I did it. Do you all know how do they have longer adolescent visits where you do your continuity?
Yeah, for our residency, it's twice as long for adolescents versus like a 6-year-old adult child. So it's really nice that you really get to kind of establish care, talk to the kid, if they bring a friend, talk to the friend.
Because it's funny with the friend thing, right? The word of mouth, and all of a sudden you're the best favorite provider in the world because you'll see all those girls together, or however it works. So, well, anybody out in cyberspace have questions or comments for Jen? Good morning. I wait my whole minute. I got trained in facilitation. Your idea about the code word, I thought that's a great idea. I've never heard that before. I wrote down a lot of this stuff because I work with health providers a lot. And that's a neat way to take care of that. I haven't heard that one before. Do you think Jane Epstein would share her quick visit protocol? Because I think that would be something that would be helpful for
probably.
health centers.
No, I'll speak for her, but I don't think that she feels like
she
like it's something that's secret. We've presented it before at the head to toe.
Okay. So
we means Jane. I was there too. Yeah. Talking about something else. Yeah. Oh, I did not give a plug for my future presentation. Is it on November 9th? No, it's not. It's in early November. I'll be talking about contraceptive counseling and include some specific information about the contraceptive implant and IUDs. It's not the 9th, but it's early November.
So Jen, we do have a question for you. And this is from Lisa Armijo. What is a good resource for recruiting providers to work with adolescents? They say they're having a hard time finding this type of provider.
We've met before. Yeah. Well, I guess it would depend. Is it recruiting a provider from far away, or is it recruiting a provider from in the community? I think a good start, if it's within the community, would be ask the adolescents in the community who they've found to be helpful when they go to see them, because the provider themselves might not identify that that's something that they're doing well, but asking the adolescents who they like can be something that then it's a great compliment to take to a provider in your community and say, hey, some of the teenagers here really like seeing you, and would you be willing to do like a teen clinic, a half day a week here or whatever? So I think that that's one approach. And then in working with providers all over the state, I've noticed that a lot of providers do self-identify as having a special interest in adolescents, but that might not be super clear. Like I think Lisa's a nurse in one of the schools in Pecos. If she's not in the clinic systems, she might not know who's self-identified as someone who's interested in adolescents, but the front desk people probably know because they probably put all the adolescents with whoever's interested. So I would say talking to the clinics in your community and just finding out like, hey, who here is interested in adolescent care? Even if the provider doesn't feel super comfortable or competent, between identifying which patients in the community like working with that provider and talking to the staff to figure out who does that best, I think that's a good way to foster that. And then if you've identified someone who's like, well, I think I'd be interested, but I don't really have those skills, doing this certification program is a really great way to build up those skills. Maybe even just identifying someone that you know in your community and saying, hey, I think this would be a really good thing for you to do. I mean, I thought that I knew a lot about adolescent medicine, and I did this certificate program 2 years ago, and I still use the resources very regularly that I got from it. So I think it's good for people even if they think they know.
Thank you for all the plugs.
Yeah.
Because you plugged the Pegasus, and that's going to be a great talk. We do several projects with Pegasus, and it's all about the medical-legal partnership, and that really, there's so many places that fits together. We're really looking forward to Dr. Baca coming on and doing our head so we can just talk about that importance of screening. And what else have you been plugging? You just plugged the adolescent initiative.
That's it, yeah.
I really would encourage all of you that have signed on for this first one to think about actually getting the certificate. It's not as scary or as intimidating to present a patient as you might think, because this is a very friendly bunch. Our specialists are very friendly. You have 3 different opportunities to do it, and you only need to do one. And, you know, we can even help you make up a case if you no longer provide care directly to adolescents. Like, I no longer provide care directly, but I'm still very interested and want to support providers that do around New Mexico. So really consider joining our certificate program.
Alrighty, and Lisa Armijo does say thank you. We're on a private chat at the moment. So Lisa, you can change that under the 2 so we can see it on the big screen. But I'm always more than happy to relay that. We did have one other request from everyone. Your feedback is very important to us in order to help us improve on our delivery of the content, as well as, you know, anything you have to say about the content. Let us know through our survey. I did post that, and I will post that here in just a moment to make sure that you have it. We typically will email that out to all participants as well. So if you could take just a couple of minutes and go to that SurveyMonkey, and although I think we have it on RedCap now, and here you go. There's the link again. Just takes a couple minutes, and it really does help us improve, especially on the technical end. So thank you all again. And did we have any other questions or comments before we sign off today?
I would like to say that next week we'll have Dr. Jacqueline Fridge joining us to talk about hepatitis C in children. And we are working right now on very low funds, but we're making it go far. Maya's involved in this project also, where we're developing a registry for children with hepatitis C, and what might a treatment path look like as the medications are opening up. How do you find these kids in your clinic, and how do you have the conversation about sex, drugs, and rock and roll related to hepatitis C with teenagers? And Dr. Fridge will do an amazing talk with us next week, so come back to hear more about that. If nobody else has any questions, we will end our session for the day, and thank you so much for taking the time to join us.
Thank you.